Our technological innovation is artificial human dummies. This presentation is presented by Ali Tackett, Avery Ferguson, and Yanisbel Ruiz. The purpose of artificial human dummies is for beginner medical and health professionals to practice and perfect their skills on artificial humans so they are prepared to perform certain practices on real humans. Although these dummies do not directly help patients, they are a vital tool in the education and training of healthcare professionals. Artificial human dummies provide potential nurses, doctors, surgeons, and emergency response teams with the ability to practice their skills and techniques on realistic mannequins that do not cross any ethical barriers. Human dummies were first created to practice mouth-to-mouth resuscitation. Today, we have seen vast improvement, and now they breathe, have body heat, bleed, and much more. By simulating these and many other real-life actions, the students can get a real feel for being with a patient. Every human deserves the highest of treatment. Instead of a nurse practicing his or her new skills on a human and possibly placing them in danger due to their lack of experience, these dummies are used to provide practice to beginner healthcare professionals before they have real contact with a patient. Also, the dummy allows them to focus on the technique before they have to multitask and pay attention to making a connection with the patient. It is important that healthcare professionals feel confident in their abilities to save someone because emergency situations are high stress, with many factors affecting everyone involved. If the caretaker has their technique down, then they can focus on other factors of importance. Dummies are used in a variety of settings, from CPR classes to medical school to military drills. Dummies have increased our ability to prepare a wide range of people in the health field for real-life circumstances.
These dummies have been used in a variety of settings ranging from labor, so for those trying to get into OBGYN, there's dummies specifically for giving birth that help stimulate that type of situation, as well as specific dummies for geriatrics, chest tube exercises, obviously incisions and sutures. So there's a wide range of variety where these dummies can be used, and it helps medical students be able to practice these skills and see these situation and such processes and surgeries come across in a more lifelike manner than they would without having that experience. And it's really helpful because not only does it, give the students that better view of such a situation, but it helps the program teachers and coordinators because it gives them a better evaluation of how the class might be doing, whether or not students are actually understanding how to do sutures, whether or not students are showing that they're capable of being in front of such a situation, whether it comes to seeing a dummy react to a certain situation, how well the students are able to encompass any difficulties that might come across. So it's a great way to make sure that the students are learning and that they're getting that real life hands-on patient interaction that they weren't able to get before.
In 2016, Richard Arm, a researcher at Nottingham Trent University, released the first of his extraordinarily lifelike dummies. The dummy is made of 3D printed silicone gels and fibers. These materials give the skin and other organs a realistic look and feel, not to mention the fact that they mimic the breathing and blood flow of the human body. The purpose of this dummy is to offer a trauma surgery simulation for surgeons prior to their first real-life surgery in an emergency situation. Future versions of this dummy will include a brain, eyes, stomach, pancreas, liver, kidneys, and even a circulation system in the legs. Despite the numerous features and benefits of these lifelike dummies and mannequins, various barriers or cons exist. The first of these cons is cost. The price of one of these mannequins can vary greatly, from a couple $100s for an individual body part like a foot to over $6,000 for a full mannequin. Richard Arm's 3D printed dummy does not have a specific price tag, though it would likely be more than the other dummies on the market. Furthermore, another con is that some aspects of working in the medical field cannot be experienced until they are done with a real person. For example, a dummy will not express concern about a procedure or have family members who are worried or stressed about a medical condition. Both of these are examples of things that health professionals do have to deal with in the real world. In closing, we have a few questions for you to consider. First, consider the technological advancement we have seen in the past 20 years regarding mannequins and other tools that future health professionals practice with. With what we have seen in Richard Arm's dummy, how far do you think this technology will evolve over the next 20 years? Second, the monetary cost of these lifelike mannequins and dummies is high. Is putting so much money into developing and purchasing these dummies worth the practical experience gained from using them? Do you think this money would be better used if it were put toward diagnosis, treatment, or preventative care? Why or why not?